I'm so glad that you guys could join me. I'm Dr. Candace Drummond, clinical psychologist and single mompreneur. I created MomScapades as a place for moms like you looking for ways to create the life and lifestyle you've only dreamed of. So stay tuned because I'm going to show you how you can do just that. In fact, I go live every Friday at noon Eastern, sharing tips and strategies on how you can create a life you love. So let's get started. I'm super excited because today I'm going to be sharing with you something that's near and dear to my heart, as you can only imagine, but the things that no one tells you about mental health. So let's kind of get into it, right? We all know mental health has been the buzzword, has been on everybody's mind, especially through this pandemic. It still has that stigma though, right? We still have that almost fear, almost embarrassment when it comes to mental health. And really, we want to kind of talk about today, for me, what I want to talk to you about is just why this stigma even exists. So I'm going to be actually talking to you a little bit about an analogy that I use very often when talking to my clients. And so this analogy I want to share with you guys today. So I've always made the comparison between mental health and disorder, or a disorder such as diabetes. So let's think about that. We've got diabetes. Most of us are familiar with diabetes. It's a disorder of insulin and sugar absorption in the body. Medical illness, physical illness. Most people who have it or have pre-symptoms of diabetes, they get checked. They go to the doctor, they're not feeling well, they're not doing so good when they eat certain things, no problem, people go get checked. We know that type 1 diabetes, folks are born with it. Kids are born with type 1 diabetes. It's the one that you get before the age of 18, right? Within the mental health world, there are similarities, analogies to type 1 diabetes. There are disorders that you're born with that come as soon as you're born. So this would be things like developmental disorders, autism, ADHD, learning disabilities. A lot of these things are what they call developmental disorders. They come about when you're born, right? You're born with it. And much like type 1 diabetes, there's no cure. Right? There's no cure for autism. There's no cure for ADHD. However, again, much like type 1 diabetes, early intervention always leads to better outcomes. So the sooner that you catch it, the sooner that you start making moves toward treatment, the better. And that goes, again, like I say, autism, ADHD, those things can be actually they can be tested for, right? They can be tested for by trained psychologists like myself. And you can contact me if you're interested in having your child screened for any of these developmental disorders. Like I said, ADHD, autism, we actually do those screenings virtually. So you're able to contact me and we're able to actually screen your child for those disorders without having to meet face to face and be concerned with, again, some of those pandemic protocols and issues that are going around with that. But when we keep that in mind, if a child is diagnosed with type 1 diabetes, we're not over here making that child feel badly about themselves or even making the parent feel like they did something wrong. So again, why the stigma? Why the embarrassment? Why the meanness really about or around these mental health diagnoses? If your child has a developmental disorder, a developmental diagnosis, that's absolutely nothing to be embarrassed about. But again, just like type 1 diabetes, early intervention is key. And 2, you want to learn how to manage the disorder, right? It's something the child is going to have for the rest of their lives. Again, much like type 1 diabetes, can't cure, not going to go away. So they're going to have to learn to manage it. So not only are you going to have to learn new things, like I know if I have a child with diabetes today, if I gave birth to a child with type 1 diabetes, I wouldn't know what to do. I would have to become educated about the different treatment options, about the different ways and means to work with my child. And as my child gets older, I would also have to teach them how to care for themselves. It's the same thing, right? We have to teach these autistic and ADHD children self-regulation skills. All of these skills that just don't come naturally to them. Much like insulin absorption doesn't come naturally to the type 1 diabetic, right? So I want you guys to just, again, think about it in that manner. And so I'm going to move on because we've got 2 types of diabetes. We have type 1 and type 2. Type 2 diabetes is more acquired, right? That's the word that they tend to use with type 2 diabetes, acquired. And acquired means that you weren't born with it. There were certain things and actions and choices and even what they call dispositions that were already within you that were activated by these environmental choices and different things. And because of that, you're more likely to become diabetic later on in life. Again, that happens with mental health. That happens with such disorders as mood disorders, right? We're talking depression, anxiety, even bipolar disorder. These are disorders of mood. They're issues that occur and they affect your mood. We also have diagnoses where we talk about psychotic disorders. Psychotic disorders oftentimes also develop later in life. We have these mood disorders that develop around adolescence. We have these psychotic disorders that tend to develop late adolescence, early 20s. And because of that, we've got, like I said, these, again, blaming the victim, blaming the client, the customer, the patient, that somehow they did something in their teenage years that caused them to have these things. Not that they were already predispositioned to it. Not because that, they something else within their already established body makeup was what was to blame. But rather we want to blame the individual themselves. I'm actually going to, 1 sec, because I made a mistake. Can you believe it? My first episode, I made a mistake. So give me 1 sec. And I'm back. So, like I was saying, now we don't blame type 2 diabetics, right? Although oftentimes with the type 2 diabetic, it has a lot to do with, diet, exercise, along with, as I mentioned, these hereditary factors, right? Now, these hereditary and genetic factors, again, they exist in mental health in the same way that they exist in physical health. Now, when we think about that, right, we think about the fact that these genetic factors exist. A lot of times you'll hear people having grandparents, parents, aunts, uncles that had diabetes, high cholesterol, high blood pressure. Those sorts of things are very, very common, especially within the minority communities, right? We know that those disorders are family, like, right? They're familial, so they're passed down in genetics. This is the same again with these mood disorders, psychotic disorders. Psychotic disorders, and I know that word is again very touchy. It's a loaded word. But really it's just a disorder of reality testing. Their interaction with reality is somehow blocked or clouded or interfered with, right? That's what we talk about: hallucinations, hearing voices, seeing things, all of those sorts of things, right? Now, in the treatment of type 2 diabetes, we often have 3 courses of action, right? The first that I kind of touched on already, diet and exercise. Some people will go to the doctor and they're given a diabetic diagnosis. And it says, all right, you have diabetes, your numbers are pretty, close to the normal range. So we're not going to put you on any medication right now. What we're going to try and work with is diet and exercise. Some people will have a milder version of mental health. And I hate to use the word mental illness. In my opinion, they are all disorders of mental health, right? Because we all have health. So I don't really feed into the illness model that much. So I'm always talking about disorders of mental health. So when you're depressed, anxious, even with mild bipolar symptoms, again, even mild psychotic symptoms, some of those times, all that you need is therapy, right? Talk therapy. You go, you talk with somebody who has the skills and the interventions and the techniques to actually help you work through whatever that issue is. And so it goes away, right? Just like diet and exercise. You work through it, you learn these new skills, you learn these new interventions, you learn these new techniques, and so you can now maintain your own progress and be good, right? We don't ever need any medication. Route 2, again, like I said, with the type 2 diabetic, is usually oral medication. You know, metformin, that sort of thing. And a lot of times, those aren't permanent, right? You'll take this for a year, 6 months, 2 years, whatever is determined by the doctor, again, until you get those numbers back in range, and then you can kind of move back into the diet and exercise, and again, move into your maintenance stage. That's the same with anxiety, depression, bipolar, schizophrenia. A lot of those are increased and exacerbated in times of stress. They're exacerbated in times of pandemic, right? And so a lot of folks who may have already thought they dealt with an issue, or they were in the maintenance stage already, or really hadn't even had to think about it because their own internal talk exercises were enough, before they're not anymore. Or they find that in that moment they need more help. All right, no problem. We'll go and we'll find out what medication that you need. Same medication type of process. We got meds for depression, SSRIs, Zoloft, there's just so many. Wellbutrin, Prozac is one of the oldest and well known. We've got a lot of different medications that you can try out, whatever works best for you. Same thing with anxiety. And this may not be a lifetime thing, right? This may be something that you need 6 months, a year, 2 years, whatever it is, to manage whatever that is in your life, and get those neurotransmitters in your brain back firing the way that they're supposed to. Train that brain muscle in the way that it's supposed to be, the same way that we can kind of get our bodies back where it's supposed to be with type 2 diabetes. And then we have the third option, where sometimes you have to go on medication for the rest of your life. Now again, that diabetic who's insulin dependent, type 2 diabetic who's insulin dependent for the rest of their lives, are we calling them weak? Are we making them feel bad about themselves? No. We're encouraging them to get help. We're encouraging them to make sure that they do the things right. Hey, did you check your blood sugar today? Hey, have you gone to your doctor's visits? Hey, have you all of those things? That should be the same kind of mindset when we're talking about depression, anxiety. Some folks, the neurotransmitters were all out of whack to begin with. And so we need that ongoing lifetime support from the medications. Does that make them any different, any worse, any better? Not at all. What is most important after this whole thing, because I know it's like a lot that I just kind of threw at you in the last 15 minutes. That's how I am. I'm sorry, guys. You'll get used to it week by week. But what I want you to think is, have you ever really thought about mental health in this way before? Have you ever really thought to yourself that mental health is treated in the same way as physical health? Have you ever thought to yourself that there are levels to this? That it's not necessarily as soon as I need to talk to someone that, oh, now I'm crazy, now I'm over the edge, now I'm all of these things. But I want you to keep in mind that it's important to get to know yourself. It's important to find out where you stand. So online, I know that there are a lot of these, for entertainment purposes, personality tests, right? And they can kind of give you some idea of your levels of anxiety, depression, that sort of thing. I'd like to put out an offer just right now in my first episode that if you're interested just in a brief report, this is not something that will be valid in court or anything like that, but just a brief report on yourself, just to kind of get, okay, where are my numbers at? What do I look like as far as anxiety? Am I mild? Is my anxiety okay? Is my depression okay? Am I suffering any PTSD symptoms? Anything like that? You can always contact me. I believe you should be able to see my email address there, Dr. Drummond, psyd@outlook.com. The brief report is $50. Okay, guys, it's just $50. You can send that to me through Zelle because that goes right to the business account Avid Intellectual. If you're interested in one of our longer reports, like I talked about earlier in the episode, if you're interested in something about getting your child screened for autism or ADHD, that you can definitely send me an email as well, or you can go on my other page, Avid Intellectual Inc. That is my psychological testing company. So there you can also find out about those sorts of things as far as getting testing for your child or even for yourself if you're interested, again, in a more extensive and in-depth report on your mental health. Now, I am going to just take a quick look and see if there were any comments or any questions. I don't think so. I think everybody is all right on episode 1. I'm really excited about this. It'll be every week, and it'll only be about for 15-20 minutes. So I just want you guys to know that I'm not going to take up your whole lunch break. Okay, guys? I'm just going to come at you, give you a couple of quick things, touch on you, and let you know that I'm here. Okay, guys? So next week, same time, same channel, I'm going to be talking about stress, because stress kills, guys. So I'm going to be talking about that next week. And like I said, contact me if you're interested in just your brief report for $50, or if you're interested in a more extensive report for yourself or your child or your relative or whatever. You can contact me at either Avid Intellectual or at the email address drdrummondside@outlook.com. So thanks, guys, for joining me for episode 1. I'm so excited. I'll see you guys next week, and maybe I'll bring a mimosa, right? Bye.